Is it normal to feel pain during sexual intercourse with your partner? No, it is not normal, my dear. Sex is an intimacy which is meant to be an enjoyable experience that draws you and your partner closer together. But when sex becomes painful, you may find yourself doing anything and everything just to avoid it. While there's no doubt that painful intercourse can have a major impact on your life and your relationship with your partner, it's nothing to agonize over or feel embarrassed about. This fairly common problem, 3 in 4 women experience pain during sex at some point in their lives, can usually be resolved with the right approach. In this video we shall talk about why the pain during sex. You should know that anything that is not normal automatically becomes abnormal, hence the need for this video. So this is what motivated me to do this video. My story. I call it, Need to Decrease Acceleration on the Highway. So during honeymoon just after my wedding, the latest couple wanted to enjoy themselves. But guess what? The enjoyment rather became sorrowful. We wanted to have sex. Just after 2 penetrations, my partner was shouting. Initially, ignorantly thought I was a man, trying to make my new wife happy. After my next set of penetrations, I realized that it was not normal. Many thought were going through my mind, just imagine a desperate soul. At first I thought, is it the size of my manhood? Or is it too big? My partner was feeling so guilty and started apologizing. Well, I call my doctor friend to inquire whether my wife and I are safe. The response was quiet, safe or positive. Finally she was diagnosed and was treated. Currently, I hear good sound from the bedroom. Anyways, that was just by the way. Here are some causes of the pain during sex. Vaginal dryness. Vaginal dryness can cause pain when your vagina is not lubricated during sex. Dryness can be caused by several things, including 1. A lack of arousal. 2. A disease. 3. Stress. 4. Breastfeeding. 5. Recent birth. 6. Trauma. 7. Menopause. If you can't get wet during intercourse, you're not alone. It happens to many women, and it's often normal. You can solve vaginal dryness by using a personal lubricant. Lube is made to increase comfort and fun during sex, so you don't have to worry about your body doing it for you. If you feel that something is wrong or that your pain is not related to dryness, always speak with your doctor. Vaginal tearing. Your vagina may get hurt during sex if you frequently have rough sex while dry or with a large object or penis. Some women may have vaginal atrophy, which causes their vaginal walls to become thinner. This condition is more common in women going through menopause. Vaginismus. Vaginismus is a psychological body response to penetration. Some women have a fear of having anything inside of their bodies. The muscles in the vagina will then tighten, which is unintentional on the woman's part. This condition can be extremely painful and distressing. It may accompany sexual trauma. With the help of a therapist or counselor and your doctor, you may be able to get comfortable again. Endometriosis. Endometriosis is a condition that causes growth of the lining of your uterus in other areas. It can cause extreme pain in your lower abdomen and during sex, especially if it grows near your cervix or vaginal walls. Always see a doctor to get help for this condition. Ovarian cysts. An ovarian cyst is a cyst that grows on either one or both of your ovaries. It can cause lower pain right around your pelvic area. Ovarian cysts can be removed or diminished with birth control therapy or surgery. Pelvic inflammatory disease. Pelvic inflammatory disease causes your body to become inflamed in the pelvic region. This inflammation can be caused by autoimmune conditions, stress, and other health conditions. You'll want to see a doctor to see what is causing the inflammation. Interstitial cystitis. This condition has similar symptoms to a UTI, which can be extremely painful. It causes pain in the bladder and urethra, which can be constant or come and go. You can see a urologist to get more information and treatment. Pelvic floor dysfunction. Pelvic floor dysfunction is more common in older women, but it is possible for young women also to experience this condition. In PFD, your pelvic floor muscles become weak and cannot support your organs as well. It can cause prolapse and pain, so seeing a doctor is essential. Pelvic floor injury. If you've had an injury to your pelvic area, you may experience pain during sex. The pain may be caused by trauma, bleeding, or bruising. You can bruise your cervix even during regular sex if it is rough. If your pain persists for more than a week, see a doctor. Vulvodynia. This condition is extreme pain in your vulva and vaginal area that doesn't go away. It can be caused by touching the area, sex, and even sitting. You will need a doctor's diagnosis and treatment to find relief from vulvodynia. Infections. A vaginal or urinary infection can cause pain during sex. Since the body becomes inflamed when you have an infection, it can quickly become irritated with too much touch. You can take antibiotics and other medicines to reduce this pain and get rid of the infection. Fibroids. Fibroids are growths in the uterus and surrounding areas of the reproductive system that cause intense pain in many women. Pelvic congestion syndrome. If you have chronic pain during sex and in your pelvic region, you may have pelvic congestion syndrome. This condition can be caused by enlarged veins or trauma. Luckily, there is hope through treatment. Symptoms and signs that painful sex is from a vascular condition. Here are some common signs and symptoms that your painful sex is caused by your vascular system, nerves and veins. 1. Your pain lasts for more than 6 months. 2. You feel like you have considerable, heavy weight stuck inside you. 3. Your pain worsens after prolonged physical activity, such as sex or long periods of standing or sitting. 4. When you lay down, your pain feels better, as the blood is not pooling in the pelvic or abdomen region. 5. You experience leg pain or vaginal pressure. 6. You feel pain during sex or after sex, such as described above. 7. Your menstrual cycle is painful. When to seek medical attention. Now you should have a better idea of what causes pain during sex. You should seek medical attention whenever your pain is distressing and frequent. If you experience pain for more than a few days, or you can't find the cause of pain yourself, a trained gynecologist will be able to help you. In some cases, vascular disease may be the culprit. Either way, treatment is available to help you get back to your everyday sexual life. Thank you for watching this video. Please do well to subscribe to this channel. Bye for now.